my name is Tawny Dorr, and I will be your student nurse today. I just have a few questions before we get started. Can you tell me what your name is? Your full name? Corbin Dorr. Okay, and I just have to peek at your wristband. Thank you. Can you tell me what your birthday is?
May 8th.
Very good. And I just would like you to know that I did wash my hands before I came into the room. Are you in any pain today? Are you having any tenderness anywhere or anything?
No.
And do you have any allergies?
No.
No. Okay, so what we're going to be doing today is I'm going to be doing an assessment of your head, your eyes, your ears, your nose, your mouth, and your neck. Okay? So before I get started, I'm going to put my gloves on. Okay, and I'm going to go ahead and start by palpating your skull, and that means just to touch. I'll just be touching your head, okay? All right, so I'm palpating your skull. Seems that you have a normal cephalic, very symmetrical on each side. Now I'm going to just do a quick assessment through your hair, okay? Your hair is fairly thick and evenly distributed, no signs of infestation. Looks very nice. Now, did any of that hurt when I touched you?
No.
Okay. And now I'm going to move down to your temporal mandibular joint. Okay, have you ever had any problems eating or any problems with your jaw clicking during mastication?
No.
No? Okay. All right, now open your mouth for me. Very good. Close your mouth. No signs of clicking. Both equally bilateral. And if anything hurts when I touch you or sore during this process, go ahead and feel free to stop me if it hurts, okay? All right, now I'm going to move on to your face. We're going to do your facial expressions, okay? So go ahead and raise your eyebrows for me as tall as you can. And don't let me push them down, okay? Very good. Now go ahead and close your eyes tight for me and don't let me open them up. Very good. And puff out your cheeks for me like this. Very good. Now go ahead and smile for me. And frown. Very good. Have you ever had any problems with your facial muscles or any expressions in your face?
No.
No. Okay, very good. Now I am going to move down to your lymph nodes around your ears and on your neck. If you could sit up straight for me. Thank you. All right, so I'm going to start with your temporal artery here in front of your ears. Okay, they are bilaterally equal. Very good. And for your lymph nodes, I'm going to start with your preauricular lymph node in the front of your ears here. Very good. Your postauricular behind your ears. Very good. And your occipital lymph node. Okay, and down to your tonsillar lymph nodes. Okay, and your superficial cervical. Okay, and your deep cervical lymph nodes. And your posterior cervical lymph nodes. Very good. And down to your supraclavicular lymph nodes. Very good. No signs of swelling or anything like that. And now I'm going to move back up to your eyes, okay? We're going to do a little assessment of your eyes. The inside of your eye, your eyelids, your pupil, your sclera, and all the things like that. Do you wear glasses?
No.
Or contacts? Have you ever had any problems with your eyesight?
No.
No. Okay, so go ahead and sit up straight for me so I can see your eyes. Okay, both eyelids look very symmetrical. Good healthy color to them. Your eyelashes look evenly distributed. Okay, and now I'm going to take my pen light and we're going to do a little assessment on your eyes, okay? So keep looking at me. Your sclera, which is the white part of your eye, looks very white and healthy, no signs of jaundice. Your pupils are approximately 7 millimeters in size, no signs of anisocoria. Very good. Now I'm just going to pull down your eyelids like this so that I can see the inside, okay? All right, so when I do that, look up for me. Very good. Your conjunctiva looks pink and moist, no discharge, no sign of sores, looks very healthy. Both corneas look great, your iris looks great, good healthy color. Okay, now I'm going to take my pen light to see how reactive your pupils are, okay? So sit up straight for me, thank you. And what I want you to do is I want you to focus on that curtain over there, okay? And I'm just going to shine this pen light into your eyes from the side to see how reactive your pupils are, okay? All right, so keep focusing on that curtain there. Very good. And this side. Nope, keep looking at, there you go. Keep looking at the curtain. Very good. Both pupils react equally. They equally converge. Let's see here. Okay, and now I'm going to assess your eyes for accommodation. Okay, so what I'm going to do is I'm going to pull my pen approximately 12 to 16 inches from your face. Okay, and I want you to keep your head very still, but I want your eyes to focus on this pen and follow it wherever it goes. Okay, you ready? All right. Yep, don't move your head. Just follow the pen with your eyes. Very good. All right. And just a few more. Very good. Okay, both eyes accommodate equally. They're equally bilateral. Perfect. Okay, now I'm going to move on to your ears. I'm just going to be palpating around your ears, which means to touch. Have you had any problems with your hearing? Do you wear hearing aids? Do you have any tenderness or soreness? Okay, so I'm going to start by palpating, which means to touch, you remember. So I'm going to palpate both ears, the pinna, pulling them. They're both symmetrical and intact, no lesions or redness. Very pink, healthy color. And now I'm going to palpate your tergus right here. Okay, and now I'm going to take my pen light and I'm going to shine it into your ear just to make sure they're looking kind of healthy, okay? All right, so I pull the pinna up and back, shine my light inside, no foreign objects, no discharge. Look very healthy and moist. So now I'm going to come around for the other ear. I'm going to pull the pinna up and back. And I'm looking in your ear. There's a healthy gray tympanic. No foreign objects, no drainage. Everything looks great. All right, and now I'm going to move on to your nose, okay? So have you ever had any problems with your allergies or your nose being sore or your breathing? Okay, so first I'm going to palpate both of your nares to look for pansy, okay? All right, go ahead and flare your nostrils for me like this. Perfect. Both are symmetrical and they both flare bilaterally. Now I'm going to take my pen, I'm just going to shine it up each nair to make sure they're healthy and they look good inside, okay? All right, for the right one, it's a very healthy pink color, no signs of lesions. And same for the other side, no polyps. Both nares are symmetrical and bilaterally equal. Okay, and now I'm going to move down to your mouth, okay? So looking at your mouth, your lips look very pink and moist and symmetrical. They look healthy, okay? And now I'm going to ask that you open your mouth. Have you ever had any problems eating or with your teeth or anything like that? No? Okay, go ahead and open your mouth. I'm going to shine my pen light inside at your buccal mucosa. No signs of lesions. Very pink and moist, healthy color. Hard and soft palate look good. Teeth are intact. Okay, now what I want you to do is stick out your tongue for me. I'm going to put my tongue blade on your tongue. Open up wide for me. And I'm just going to press on your tongue and I want you to say ah. Say, there you go. Very good. Tonsils look like they'd be at a 2+. And now I'm going to test your gag reflex. Okay. All right, very good. Your mouth is very healthy, pink, moist. Teeth are intact. Everything looks very good. Okay, your overall personal appearance, you seem to be in a good mental state. You seem very happy. No problems with sadness or depression or anything like that. Right? Okay. Okay. And I believe that is all today. So thank you for letting me do that assessment onto you today, and I hope you have a very good day.